views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hello and welcome to Open BXRx, BronxNet's special coverage providing you the latest information, resources, services, and community efforts taking place locally here in the Bronx and virtually throughout the pandemic. I'm your host, Sonyi Lopez, and today is Tuesday, November 10th. Coming up, the Medicare annual election period has begun. Stay tuned to learn more about your choices with Oscar Health and Montefiore's Medicare Advantage program. Then we'll discuss hashtag Bronx Digital Equity and how Bronxites have been facing the digital divide during the pandemic with Bronx Impact. After that, Montefiore and Robin Hood have created the Family Resiliency program to help families in the Bronx who lost loved ones due to COVID-19. We'll share the criteria to qualify for this program later on. And tomorrow is Veterans Day. Manhattan College, in partnership with BronxNet, present Forward Together, a public conversation exploring issues that affect veterans. So please, stick around. Open BXRx starts now. Welcome to Open BXRX on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. Medicare's open enrollment or annual election period began on October 15th. This means that Medicare users now have the opportunity to reevaluate part of their current plans. COVID-19 has shown us how important it is to have access to convenient, high-quality, comprehensive coverage. Oscar and Montefiore have partnered to offer convenient and affordable care with the doctors you trust. Joining us now to share more is Dr. John Murphy, Northeast Regional Medical Director at Oscar. Welcome. Thank you so much for joining us, Doctor.
Thank you, Sonyi. My pleasure.
So first, for those who are not familiar, can you share more about Oscar Health Insurance and your mission?
Absolutely. Well, to begin, Oscar has grown significantly since its inception in 2012. Currently, we have over 420,000 members in about half of U.S. states. And our mission from the beginning has been to focus on members and their needs. Firstly, by providing affordable health care without sacrificing high quality. It's our goal to help members to stay healthy and get the most out of their plan with Oscar. Finally, we want to guide our members to doctors and to hospitals like Montefiore that they trust. And lastly, we want to facilitate relationships. First, personal relationships between members and their physicians so that they can get optimal care and they're well known to their doctors. And secondly, to facilitate relationships with Oscar itself so that our members can take advantage of everything that we're bringing to the table.
Thank you, Dr. Murphy. And just, we're speaking to Bronxites, and Bronxites are viewing the show now. And we just want to speak about ensuring that Bronx seniors choose the right plan, especially while navigating this pandemic. How can we ensure that through Oscar?
Absolutely. Well, the first thing to realize is that healthcare changes over time, and our healthcare needs change over time with a number of things. The first being age, and the second thing is with environmental influences. And the best example right now of that is COVID-19. And this pandemic has made it very difficult for all of us to access our health care. That being said, we know that the people of the Bronx are very strong, they're very independent, they want to manage their own health care, and they want to be participants in maintaining their health. And basically, we want to help them to do that, and Medicare Advantage offers them significant options to customize their health insurance to meet their individual needs. And the best time to take advantage of those opportunities is during the AEP that's currently ongoing.
And speaking of the enrollment period, please tell us more about Oscar's partnership with Montefiore in Medicare Advantage. What is it and how can people sign up?
Sure. Well, Oscar's partnership with Montefiore began in 2019. And as I said, the fundamental tenet of it is to provide convenient, affordable care with doctors you trust. And we have basically been able to create a network of trusted physicians and health systems that we vetted, namely Montefiore physicians and the Montefiore health systems that we know provide high quality medical care. Furthermore, we know that our members in the Bronx are familiar with them and trust them because they're in their own community. But in addition to this relationship that Montefiore brings in terms of high quality, there are several things that Oscar also brings. The first is we have a concierge connected care team. And the purpose of these guides is to help our members to interface with Montefiore in order to simplify those interactions and to the extent that we can to make healthcare easy. The second thing is, in many ways, Oscar is a technology company. And one of the things that we're able to do is to leverage that technology on behalf of our members. So for example, we offer virtual care in the form of telemedicine, not as a replacement for the patient's in-person visit with their primary care doctor, but to supplement it, for example, in times like these, when it's simply inconvenient to make a trek to the doctor's office. So that's a very valuable add-on.
Doctor, let's track back just a little bit. Can you help us define what an Medicare annual election period is and when it ends for anyone who's listening and may not be familiar with the terms?
Absolutely. Well, the so-called AEP is an opportunity for everyone who's enrolled in Medicare to take charge of their health care. It's an opportunity for them to disenroll in their current plan, to re-enroll in another plan, or potentially to change the plan that they're in within a particular provider. The actual period itself extends from October 15th through December the 7th, and any benefits that are elected will take place then on January 1st, 2021. There are a number of questions that always arise as how do I choose what to do during the AEP? It's very confusing. Well, there are a number of things that people should consider. First is, what are the out-of-pocket expenses relative to my needs? So for example, depending upon the plan, Oscar offers an opportunity to have a $0 premium plan, a $0 co-payment with their primary care physician. And these are things that tend to be very attractive with patients. In addition, people should be concerned about prescription drug benefits because the prescriptions that we need are very, very expensive. Again, depending upon the plan, Oscar offers $0 copay for Tier 1 and Tier 2 drugs. We offer same-day reordering over the phone and zero-cost same-day delivery of those prescription medications. Other things that people should look at is what is the star rating of the plan. The higher the star rating, the higher the quality of the plan. They should also look at that menu of extra benefits that we talked about. One of the things that some members don't realize is we're obligated to produce benefits that are equal or better than what Medicare itself provides. And in order to be competitive with other Medicare Advantage companies, we offer that menu of additional benefits. At Oscar, they include vision, they include dental, they include hearing benefits, which are very unusual. In addition, there's a very lucrative over-the-counter pharmacy benefits, all of which our members find to be very valuable.
Thank you, Doctor. And what is the initial enrollment period? Who does this apply to?
The initial enrollment period is somewhat of an automatic enrollment in Medicare that happens generally around the 65th birthday of Medicare eligible people. It usually begins around 3 months before and extends for about 7 months. The point that's really important here is that the annual enrollment period is much more beneficial to the patient for a couple of reasons. Number one, they understand the Medicare system a little bit better. And number two, they've had a chance to evaluate their own healthcare needs over the year and consequently have a better ability to customize a plan that's very specific to their needs.
Sounds wonderful. And as we know, shopping for Medicare can be very tricky. How does Oscar make this process easier through things like the Oscar app?
Well, Oscar does a number of things. The first is we provide enrollment guides so that people understand what the benefits available to them are. In addition, we have a team of personal guides who can talk members or prospective members through the pros and cons of various plans that they're considering. We do have a very robust website with lots of information. And as you mentioned, we have a telephone app with the same bit of information. Just to note, we also offer 2 plans in the Bronx this year. And that, again, is along the philosophy that we want our members to be able to customize and choose the plan that's best for them. So if they have more significant health needs, there's a particular plan that they might want to choose. If they're a little bit more cost sensitive, there's a plan that's also eligible for the low-income subsidy provided by the government. So again, choice to meet your individual needs is very important to us.
And how can people find out more and sign up to get connected with Oscar?
Well, there are 2 ways. The first is they can give us a call at 718-514-2374. And the alternative is to just log on to our website at hioscar.com/Medicare.
Thank you, Dr. John Murphy, for joining us today and telling us a little bit more about Oscar and Montefiore's partnership in Medicare Advantage.
Thank you. My pleasure.
Of course. Folks, again, the number's on the screen if you want to make a change but aren't sure how to get started. It's 718-514-2374. You can find out more information on Montefiore and Oscar plans. And remember, the annual election period ends on December 7th. Act now so you can get the Medicare Advantage you've earned. We'll be right back.
Joanna Edmondson is raising awareness around breast cancer with her exercise group, cleverly titled the Female Fight Club.
In the United States, 276,000 women and 3,000 men are diagnosed every year with breast cancer.
Edmondson organized a 5K marathon run in collaboration with the Susan G. Komen Foundation to raise awareness for the cure for breast cancer.
It's important to the community because during these times, we need to unite and we need to fight together.
The group has over 200 members and growing, some survivors themselves, who say they want to encourage others through their own experience with breast cancer.
I'm a 20-year survivor as of December 18th, and not only 1 but 2 breast cancer diagnoses. And it's about pushing forward, having the faith, focusing, having that mindset to strive.
If you're interested in getting involved, visit them at their Facebook page at Female Fight Club NYC. Reporting for BronxNet, Darissa White.
Transporte público, no toques su teléfono. Lleve desinfectante para sus manos y úselo inmediatamente al salir del autobús o tren. No te toques la cara. Si alguien tose o estornuda, aléjase. Lávese las manos con agua y jabón lo antes posible. Limite el contacto con los postes. Si es posible, evite las horas pico. No comas ni bebas en transporte público. Mantenga su bolsa del piso o otras superficies. Evite tocar directamente los torniquetes. Manténgase al día con lo último de su Departamento de Salud local y el CDC.
Media network for you.
BronxNet TV.
Come learn in your new state-of-the-art studios at Lehman College.
At Mercy College.
And coming soon to the South Bronx in the Hub.
Inspire with your stories, culture, history.
Your Bronx on BronxNet.
Engage with us.
Connect with us at your channels and at BronxNet.tv.
Learn, engage, inspire. BronxNet TV.
From the Bronx
to the world.
BronxNet.
Welcome back. Bronx Impact seeks to dismantle structural racism in the South Bronx by working closely with community members and organizations to identify challenges and uncover solutions. One of those challenges is Bronx digital equity. What is it? Here to share more is Rose DeStefano, Senior Director of Collective Impact at Bronx Impact and the Children's Aid Society. Welcome, Rose. Thank you so much for joining us today.
Thank you so much for having me.
Of course. For those who are not familiar, I gave a little bit of background, but can you tell us more about Bronx Impact and your mission?
Yeah. So you got it right. Our mission is to dismantle structural racism and address long-standing and unjust inequities in the South Bronx, so residents can realize the community's shared vision of a vibrant neighborhood with infinite opportunity where people aspire to live, work, and raise families. And we do this by bringing together Bronx residents, nonprofits, businesses, and government officials to implement solutions to increase social mobility in historically divested communities.
Thank you so much for sharing, Rose. And how has the pandemic shifted your work? What types of resources and services has Bronx Impact been able to provide through this time here in the Bronx?
Our work has shifted in a few ways. So we really doubled down on our efforts around our online resource website called my.bronximpact.org, where people can find services and programs in their neighborhood by typing in their zip code. Over 8,000 residents have used my.bronximpact.org since March, and also created a call center and staffed that with 25 young people in the Bronx, offering support in 7 different languages. We knew that the digital divide, digital divide, people needed a different way other than a website to find the support that they needed. We also, we host a lot of convenings. And so rather than, focusing these convenings on the very long-term issues, we started to host convenings that were more focused on emergency relief. And so, we shifted our model a bit, and we're able to help, in one instance, over 300 childcare centers, many that were owned by Black and Brown women, apply for PPP loans and get access to supplies like diapers and masks so that they could stay open. We created a letter for essential workers who were traveling after curfew. Remember when there was a curfew?
Oh, yes.
Because people were being fined for traveling from their jobs, from a lot of essential workers who are working at hospitals, service agencies. Right now and summer, we've been working with schools to implement a more holistic, healing-centered approach for students, parents, and teachers, knowing that, especially as mental health has become more and more prevalent in low-income communities, this is something we really want to see show up in the schools. And we've also played an advocacy role with the Mayor's Office of Food Policy, the Department of Education, and the Administration of Children's Services to correct policies that had unintended consequences negatively impacting Bronx families. The last thing I'll mention is about the Jerome Avenue Revitalization Collaborative, also known as JARC, which is led by our partner Jobs First NYC. They've launched a hub for employers and workers to get the support they need to stay in the neighborhood around the Jerome Avenue corridor, despite the rezoning, and are trying to, and I think successfully now, shifting some of the wealth that's coming into that community so that it stays in the neighborhood. So now that we're out of emergency mode, we're still in a crisis in this pandemic, but it's not as rapid, I think, as it was in March, April, and May. We are focusing again on those long-term systems change issues and examining our different systems, identifying root causes, and hosting community conversations to reimagine a future for the Bronx. So again, so that residents can realize the community's shared vision of prosperity and vibrancy in their neighborhood.
Absolutely. Thank you so much for sharing, Rose, all the services and resources that are being offered to families during these tough times, and how we're all still sticking together even throughout the pandemic and, all the difficulties around politics and all that good stuff in the Bronx. Rose, I wanted to explore one topic that you brought up. Families and children in the Bronx have long faced something called the digital divide or tech disparity. Can you help us define these terms and why the Bronx is so affected by this?
Sure. So the digital divide speaks to a lack of connectivity and tech literacy. The problem is that 40% of New York City households lack the combination of home and mobile broadband, including 18% of residents, that's 1.5 million people, who lack both. This is a data point from the New York City Internet Master Plan that was released earlier this year. When we're talking about tech disparity, we're looking at how those 1.5 million people don't have a strong enough connection to sign on to Zoom classes, sign up for telehealth appointments, access city eviction prevention portals, sign up for unemployment benefits, or even find food on things like the Get Food NYC website that the city launched during COVID. In the Bronx, there are over 265,000 people who are not connected to the internet and are at a clear disadvantage. It's not just that people can't connect, it's that their inability to connect it's creating a scenario where they are more at risk than those who are food secure, have stable homes and stable jobs.
It only makes sense, no? And recently, the Bronx Borough President Ruben Diaz Jr. held a Tech Equity Day of Action. He stated that out of 200,000 students in the Bronx, 84,000 received tech devices for remote learning. So that leaves out 116,000 kids. They don't have access to these devices. Just to put it in perspective, these are only families that have responded to the surveys. It's not counting everyone else, no? Just tell us a little bit more about what took place that day, Rose, and how Bronx Impact is spearheading the initiatives with other organizations and the BP's office in order to get help and not only bring up the issues, but provide solutions as well.
Absolutely. Yeah, well, one thing I'll say is that we are not moving alone. We have to work together, and we are collaborating deeply with our other partners that are leading in this work. And so the Bronx Borough President's Office invited Bronx Impact, South Bronx Rising Together, The Point, and the Bronx Community Foundation's Tech Equity Coalition, which is led by DreamYard, to host an event and bring light to the Bronx digital divide. We know that this has been an issue, since March. It's been an issue even before March, but it's been too long now, and we're still not seeing the changes that we need in kind of urgency and immediacy. So the message is that we have to keep fighting for equitable access to education so that all children, regardless of their race, their gender, geography, and socioeconomic status, have the same opportunity to learn. At the event, there were some elected officials. Johnny Peralta from The Point showed us his internet in a plastic bag to demystify the internet for Bronx residents. And some parents spoke and advocates, and then a student named Lucky Islam also spoke about her experience and those of her peers feeling forgotten, left behind, and that they demand justice. So we created a list of demands, which were read by the borough president, and are now, we are all in the process of co-authoring a sign-on letter, which will be sent around next week.
Rose, can you share what types of demands community members, advocates, and organizations like Bronx Impact are making?
Yes, thank you. Yes, so there are 5 demands. The first is that the DOE needs to provide appropriate devices to all students immediately. We have to ensure that students and families have equitable access to learning devices, and the DOE needs to provide those the next necessary technology. So this is computers and tablets, hotspots to all students, and especially for students that are living in shelters. The second demand, we need to improve communication to families around the distribution of devices. The DOE need to put better systems in place that prioritize communication to families regarding the status of their request for a learning device. Parents and caregivers, once they've placed a request for a device, they should be able to track those requests in a timely manner and know when it's going to be arriving so that they can plan appropriately around that. And we can do that over text message. It just needs to be implemented. We need to hold internet service providers accountable, also known as ISPs. So ISPs, they've become gatekeepers to student success. Without affordable and accessible internet access, students are unable to complete assignments and to learn, making it nearly impossible for them to be successful academically. ISPs must provide pathways for subsidized, free, or affordable internet access, and the city needs to hold those ISPs accountable. The fourth demand is that we need to institutionalize technology assistance for students and families. It's not effective or efficient for families to wait for long periods of time on a call line or to wait for the DOE personnel to return their call regarding technology assistance. DOE schools need additional funding and support to provide their own technology assistance to teachers and to families. The system should always include ways to escalate cases that are unresolved in a manner that's timely and transparent for both parents and teachers, as any online technology support system would do. And the last demand, though we have others, but we're really trying to keep it to these 5 demands, is that we need to ensure the quality of remote learning. This looks like the DOE providing accurate and timely reports on how students are engaging with online learning, how learning loss is being accounted for, and what policies and practices will be put in place for students who are struggling to navigate the complexities of online learning. Additionally, there needs to be enforced standardizations of remote learning teaching and what pedagogies are utilized to increase the likelihood of learning and retention. And virtual support systems should also be offered to students that are facing learning barriers. These are students with disabilities, multilingual learners, and students who are behind target levels. So we really need to come together and fight for our children, because all children deserve to learn, regardless of their race, gender, geography, or socioeconomic status. That should not determine their ability to access quality education and opportunities.
Absolutely. Thank you so much, Rose, for sharing. And let's say someone is tuning in, how can they stay connected with you and learn more about Bronx Impact as well as Bronx digital equity here in the community?
Sure. Yep. So you can always go to our website, bronximpact.org, and connect with me there. You can also sign up for our newsletter and get updates. We're on Instagram, Twitter, and Facebook. And if you're looking for resources or programs or just support, you can always visit the my.bronximpact.org website or our call center, which is 646-762-7483. And I know Bronx Impact is also going to show that number as well. But we would love to connect with you and support.
Thank you so much. Rose DeStefano, Director of Collective Impact at Bronx Impact and the Children's Aid Society. Thank you so much for joining us.
Thank you so much. Have a great day.
Folks, again, to find out more about tech equity in the Bronx, follow at Bronx_Impact on social media. Additionally, if you need food, My Bronx Impact is here to help. Call the number that Rose provided, 646-762-7483. It's right at the bottom of the screen. Or you can visit bronximpact.org for more information and updates. We'll be right back.
We know that people are dealing with the health crisis, but there's also a lot of food insecurity.
We're giving out healthy food options, and that's what's key here.
If you're a senior, you have a disability, they'll actually deliver meals to you.
The residents are anxious, they're worried, they're scared, they want to be tested.
When things were happening in our community and we couldn't get the help.
There's almost a presumption of criminality that attaches to your skin color.
The site will prioritize those who are at highest risk in the population.
If you feel symptoms and you'd like to visit one of these COVID-19 testing sites here in the Bronx, you may call the State Health Department's hotline.
Important to note about this site is no reservations are needed. This is a walk-in clinic.
A lot of us are out of work and looking for something to do.
We have the machinery and the skills to make large scale of these masks and gowns.
Take care of your people. It's going to go way further than we actually can understand.
Right now, employees like myself are just adjusting to the new reality.
Reporting from BronxNet, this is Trans.
why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
So we're asking everyone to be selfless for others so that we can protect those who are most susceptible.
Not going to bars, not going to restaurants. It all just means physical separation so that you have a space between you and others.
For more information on how you can social distance, please go to coronavirus.gov.
Welcome back. After witnessing the hardships of families in the Bronx who lost loved ones due to COVID-19, doctors at Montefiore Health System created the Family Resiliency Program with support from Robin Hood. Joining us now to discuss this program and see who qualifies is Diana Hilario, social worker at Montefiore Medical Center. Hi, Diana. Thank you so much for joining us today.
Hi. Thank you for having me.
Of course. So just to get right into it, Diana, let's discuss the impact that this pandemic has had on our Bronx families in particular, and the importance of supporting these families at this time.
Yes, COVID-19 has really impacted our Bronx families during this time because it's still going. We've had about 4,000 children in New York State who have lost a parent. So this has really impacted our communities.
Thank you for sharing, Diana. I wanted to learn how Montefiore is helping families who lost a breadwinner from COVID-19 with a Family Resiliency Program. What is the Family Resiliency Program, and how do families qualify to get this help?
Yeah, Montefiore created the Family Resiliency Program to provide support to our families as well as financial support during these times if they qualified for the grant that we received from Robin Hood. We are speaking to families who are referred by either a social worker, a nurse, a doctor, or a healthcare provider.
And Diana, let's say someone is tuning in and they want to know if they qualify. Can you just list the criteria for the Family Resiliency Program?
Yes. The families have had to have a family member who is a caregiver or a breadwinner pass away from COVID. They have to have a child under the age of 26 years old living in the home. They also have to have financial stressors in the home, such as not being able to pay utilities, rent, provide food for their family. And the grant is for families who live in New York City and the Hudson Valley.
And just share why Montefiore and Robin Hood decided to partner and begin this program for Bronx families in particular.
Yeah, Montefiore was concerned about the families in our community and wanted to create a program that provides emotional support as well as financial support for the families.
Definitely a program that a lot of families in the Bronx can surely benefit from during these hard times. Diana, a quick question. Can families who don't qualify for this cash assistance under this program still get alternative help and resources like help from a social worker like yourself?
Yeah, so the social workers who are reaching out to the families are doing an assessment of the family, emotional as well as financial. So if we have a family who does not qualify for the gift card, we are providing them with resources in the community. For example, housing resources, food resources, and bereavement resources, which is something that's really important during this process.
I know the Family Resiliency Program just launched, but have you heard from a lot of Bronx families reaching out to get this help so far?
Yes, we have had many referrals from different hospitals and also clinics who have referred families for the program.
Diana, you're a social worker. Can you share more about the importance of social work through the pandemic?
Yes, social workers played a big role in the communication between the families at home and the patients in the hospital. We received a lot of phone calls of families who wanted constant updates to see how their family members were doing during their hospitalization. So that changed a little bit our workflow, because usually we had families come in and out the hospital visiting their loved ones. So that made a big impact in the communication between the patient and their families.
And how has your work changed? Is this all happening virtually or via phone now instead of the face-to-face interpersonal interactions with
So
families?
we're having families come visit at the hospital now. So we are still having communication via phone for some of the family members who maybe live out of state or cannot do a virtual call with the patient. But the family members are visiting their loved ones in the hospital now.
And as a social worker, what message do you want to share with families who are struggling right now and need help and support?
For our families right now who are going through this very difficult process, I would say if you need to speak to someone, reach out. It's very important if you have a family member, a close friend, someone in your community, or even your primary care doctor, if you have someone that you trust and you want to share with them how you're feeling, I think that's something very important. And we're also receiving that feedback from the families who we're reaching out to right now.
Right. And as you stated in the beginning, Tiana, a lot of children have faced the loss of, family and loved ones. How can we also stay connected with our children and make sure that they receive the attention and care and support that they need? It's not just, adults going through this difficult time. It's also children.
I know that a lot of families are spending time speaking to their children about losing someone and also about the grieving process. So it's just having a lot of conversations with them about what's happening in their family, in their community, and what's happening across the country. Because, a lot of everyone is being impacted by COVID-19.
Absolutely. Plenty of stuff going on around us. And, the loss is just exacerbating this stress that our children and our families are facing as well. Tiana, how can families and those in need find out more about the Family Resiliency Program? Where can they find this information and see if they qualify?
Yeah, so they can reach out to their primary care doctor, who can reach out to our social medicine department and see how the referral process is initiated.
Can you share the most common questions and concerns you're hearing from families during COVID-19?
We've had a lot of families calling us in regards to resources in the community, for example, food pantries, housing resources, employment resources, and grief counseling. So we have been providing the families those resources via phone and also mailing it to them once we finish our assessment with them. But I know a lot of families were having particular issues with applying for unemployment, going on leave from their jobs during this moment. Especially, I know a lot of families have a hard time with homeschooling their kids and, having to, pick between going to work or staying home with their children during school hours. So we've had a lot of calls from the families and with those concerns in specific, but we are mailing them the resources so they can go through them and check which resources are best for their families.
Diana Hilario, social worker at Montefiore Medical Center. Thank you so much for joining us today and sharing more about the Family Resiliency Program at Montefiore.
Thank you so much for your interest and finding out what we're doing for the families in our community.
Of course, thank you. Again, if you're a medical professional looking to refer a family to the program, you can email familyresilience.fund@montefiore.org. And to donate or become a partner, you can visit montefiore.org/family-social-medicine. We'll be right back.
Have all the location needs right here in our backyard, in our local parks nearby to us, has been very helpful to many moms.
State Assembly Member Nathalia Fernandez proves it takes a village to raise a child during the Baby Needs Essential Drive at Mazet Playground in the Allerton section of the Bronx.
Today we're having a Baby Essentials Drive for new mommies, mommies-to-be, and current mommies of older kids.
The drive provides parents and guardians with essentials, including Pampers, wipes, sanitary napkins, and even groceries. According to Fernandez, the drive helps families struggling as the city fights against COVID-19.
For many people, and for new mothers especially, being able to leave your home, go to the store and get the essential items is very difficult. It's also, a little fearful to go out into the public, with COVID still happening.
Joining Fernandez, director of ICNA Relief's Bronx location, Shabir Gul, provided food for Bronx residents. He explains the Islamic-based organization stands for humanity and makes it their mission to help anyone in need.
No matter what color, what language, what base, everyone, whoever they need, we always stand with our community because we believe in humanity.
To stay updated on community events and essential need giveaways, visit Fernandez on Instagram at Fernandez4NY. Reporting for BronxNet, Kibin Aline.
Who's most at risk for coronavirus? People over 65, people with underlying medical conditions like heart disease, chronic lung disease, asthma, diabetes, people undergoing cancer treatment, and people with weakened immune systems. What should you do if you or a loved one is at higher risk? Avoid close contact with people, avoid crowds, stay home if you can, wash your hands frequently, learn more ways to protect yourself and others at coronavirus.gov.
Why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
So we're asking everyone to be selfless for others so that we can protect those who are most susceptible.
Not going to bars, not going to restaurants. It all just means physical separation so that you have a space between you and others.
For more information on how you can social distance, please go to coronavirus.gov.
Tomorrow is Veterans Day, a day to honor and celebrate the service of brave U.S. military veterans. In celebration, Manhattan College and BronxNet TV present Forward Together, a public conversation of great importance to explore issues affecting service members as they transition from military to civilian life. Joining us now to share more is Tiana Sloan, Director of Veteran Services at Manhattan College. Tiana, thank you so much for joining us today.
Hi, thank you so much for having me.
Of course, thank you. First, can you please tell us about Manhattan College's Veteran Services and the resources provided to veterans there?
Certainly. So Manhattan College has a long history of supporting military and veterans, but I would say over the last 6 years, we've taken a much more targeted and holistic approach about how we're supporting student veterans in their transition out of military life into college life. And that really starts with our Veterans at Ease program, which introduces veterans to various techniques of yoga and meditation to help manage the symptoms of stress. And then it goes on to, we have a very active student veterans organization that provides a sense of community and peer support. And then finally, we really look to make sure that we're addressing all the barriers to success. So whether they need a referral to mental health services, tutoring, career services, whatever it is they need, we're making sure that they're connecting with it.
Wow, I love it. Veterans at Ease, a mind, body, and soul being provided here, no? That's a beautiful thing, beautiful resource to have. Tiana, can you tell us about the upcoming Forward Together program in partnership with BronxNet TV? It's taking place tomorrow on Veterans Day.
Yes, we are really excited to be working with BronxNet to bring everybody forward together. This is a discussion around transition. There isn't as much known about what the issues are of transition. I think everybody talks about other issues affecting veterans, but transition is a really key part of that change from military life into civilian life. So we are bringing together leaders in the veterans world, many who are veterans themselves, to talk about these issues. We're going to address well-being and resiliency, finding your sense of community and service after you're out of the military, and then finally career.
And when we talk about some of these issues affecting veterans, Tiana, can we just elaborate a little more about what these issues are in their transition to civilian life?
Yeah, you know, I think when service members are in the military, they're leading very highly structured lives with a clear sense of mission and a clear sense of community around them. When they leave the military, nobody's giving them that mission anymore, and there isn't that clear sense of community anymore, and it can be chaotic for them. So this conversation is really to help start the conversation around all those things to make sure that we as civilians can be more aware and be more supportive to our military populations.
Got it. And according to the Department of Veteran Affairs, more than 4,000 veterans have passed away from coronavirus. How has COVID-19 amplified these issues affecting veterans who may have already been facing challenges prior to the pandemic?
Sure. You know, the pandemic has been challenging for everybody, but I would say particularly for our veterans, it's increased a sense of isolation. And that's why at Manhattan College, we've really worked hard to create online events, in-person events with social distancing measures, all to make sure that they're feeling connected to their community and that they're feeling supported by others. But for other veterans who are are facing this, it's increasing their stress levels and just reinforcing all of the issues of isolation.
And as we know, Forward Together is going to be streamed online and on television. So this is for everyone, not just for veterans who are part of the Veterans Services Program at Manhattan College. No, Tiana?
Absolutely. I think so often we know veterans, but they tend to be more resistant to sharing their stories or experiences with civilians. And I think this is a way that civilians can start to try and gain some understanding and maybe start to have these conversations and be more supportive to others. But I would say transition and change in life in general is stressful for everybody, not just veterans. So we're hoping that there'll be some useful tips from this to help everyone.
Right. And where can people find out more about Manhattan College's Veterans Services at this time?
They can visit our website at manhattan.edu/veterans.
Thank you, Tiana. And before we go, please invite our viewers to tune into Forward Together and honor veterans this Veterans Day tomorrow, Wednesday, November 11th.
Yes, I hope everybody will join us tomorrow on Veterans Day for the broadcast of Forward Together to view this great conversation around how we can be more supportive to our military populations.
Thank you so much for your time today. Tiana Sloan, Director of Veteran Services at Manhattan College.
Thank you.
Folks, again, you can tune in to Forward Together this Veterans Day tomorrow, Wednesday, November 11th at 3 p.m. here on BronxNet Channel 67, Optimum, 2133 Files, and Facebook Live, or online at bronxnet.org/Forward Together. That's all for our show today. Thank you for tuning in to BXRx. I'm your host, Sonyi Lopez, wishing you and your family safety and wellness now and always.